Dear colleagues around the globe, thank you for watching this video in the frame of the ITI World Symposium 2021. My name is Samir Abou-Ayash and I'm a prosthodontist from the University of Bern. And I want to present you the 5-year results of our study focusing on narrow diameter implants in mandibular overdentures. First of all, when it comes to narrow diameter implants, we have to ask ourselves, is there actually a need to reduce the implant diameter? And I think there is. Because we all know what happens if a patient loses his or her last remaining teeth. The alveolar ridge resorption accelerates, and maybe in the beginning we're able to construct a stable complete denture. But if the ridge resorption continues and we have a situation like in the bottom image, we will not be able to have a stable complete denture in the edentulous mandible. The consequences for the patients are a decrease of chewing efficiency, malnutrition, a decrease of oral health related quality of life, and finally, an increased mortality. And this is why we consider to place implants in these situations. But when we look at the bottom image, we realize that it might be very challenging to place an implant in a situation like that. Next, we should ask ourselves, who are the patients that present with such an intraoral condition? And the answer is pretty easy. Those are mostly elderly people. We learned from the last ITI consensus conference that an increased age per se is not a higher risk for an implant failure, but we have to do some specific considerations if we want to place implants in elderly people. First of all, we have a higher risk for biological complication, especially after bone augmentation or extended surgical procedures. Furthermore, those patients usually have a reduced income.